Good morning, everyone. Today I'll be covering a topic on development of occlusion. Occlusion is defined as a relationship between all the components of mastication system in normal function, dysfunction, and parafunction. Now, coming to the different periods of occlusal development, the first one is a pre-dentate period, the deciduous dentition period, the mixed dentition period, and the permanent dentition period. Coming to the pre-dentate period, this is a period during from the time of birth till the first tooth erupts in the oral cavity, that is pre-dentate period, which means there is no teeth in the jaws. In this pre-dentate period, the alveolar jaw is called as gum pad, which are pink in color. They are U-shaped, and when they are approximated, there is contact only in the posterior area, and there is open bite in the anterior region. The open bite in the anterior region is helpful for the suckling for the baby. And this gum pads are divided into two portions with the help of a labial groove which runs over the alveolus like this, and it divides the gum pad into two portions, a labial portion and the lingual portion. And further, it has got transverse groove in each quadrant, five transverse grooves in each quadrant, and between this transverse groove, there is a tooth sac present. And also there is an important landmark, that is lateral sulci, which is present between the lateral incisor and the canine. The transverse groove which is present between the lateral incisor and the canine is called as a lateral sulci. And this also is very important to know the maxilla and mandibular relationship in the future. Coming to the deciduous dentition period, this has got various features. The main important features of deciduous dentition are spaces. Now, spaces can be classified as open dentition open dentition and closed dentition. Now, what do you mean by open dentition? Where there are spaces, those are open dentition, and those don't have, if they don't have any spaces, those are called as closed dentition. Now, in case of open dentition, we have two types of spaces. One is physiological spaces, that is, the spaces which is present between all the teeth are called as physiological spaces, and the spaces which is present between the lateral incisor and canine in maxilla, and between canine and deciduous first molar, that is called as primate spaces. These primate spaces are also called as semen spaces or anthropoid spaces. Now, coming to the second important features of primary dentition, that is terminal plane. There are three terminal planes: flush terminal, mesial terminal, and distal terminal. In case of adults, we see permanent first molar for occlusion to tell about angles class 1, class 2, and class 3. But not in the case of primary dentition. In case of primary dentition, we see second molars, we see second deciduous molar, and that too the distal surface. The distal surface of second deciduous molar, depending on the occlusion, we classify the terminal planes. Now, in this case, the distal surface of upper and lower second deciduous molar are in same plane, and this is known as flush terminal plane. Now, coming to the mesial terminal plane, now if you see this picture, the distal surface of lower second deciduous molar is more ahead when compared to the upper distal surface of upper second deciduous molar. This is called as mesial terminal plane. Now, coming to the distal terminal plane, now as you can see in this picture, the distal surface of lower second deciduous molar is far behind when compared to the distal surface of upper second deciduous molar. This is called distal terminal plane. Now, all three terminal planes have been depicted in one picture, that is the flush terminal, mesial terminal, and distal terminal. Coming to the canine relationship, this is same as that of a permanent canines. In class 1, the mesial slope of upper will coincide with the distal slope of lower. Class 2, the distal slope of upper will coincide with the mesial slope of lower canine, and class 3, any other relationship apart from class 1 and class 2 is classified as class 3. Now, coming to the anterior teeth relationship, you have to know two terminologies, that is overbite and overjet. Now, what do you mean by overjet? The horizontal distance between these two incisors is called as overjet, and vertical distance between the incisors, that is called as overbite in simple words. Now, overbite in case of primary dentition is increased, but not in case of permanent. This is the normal feature of primary dentition. There could also be a edge-to-edge relation in case of primary dentition. Now, coming to the different terminologies in arch dimensions, you have to know about arch circumference. You need to know about the arch length, and you also need to know about the arch width. Arch circumference, the line which is drawn from cusp to cusp of all the molars, premolars, and the canine, and followed by along with the cingulum of upper anterior, and followed by premolars and molars. Now, what about this arch width? It can be a bimolar width, it can be bicanine width. And what about the arch length? A line drawing from the center of this incisor straight to the line which is drawn perpendicular to the uh, distal surface of the molars. These are the three terminologies you're supposed to know. And coming to the mixed dentition period, it consists of three periods: first transition period, intertransition period, and second transition period. Now, in case of first transition period, there are two significant changes happens over here. That is eruption of the first permanent molar and exchange of incisors. These are the two significant changes do happen in the first transition period. Now, when the second deciduous molars are in distal step, then how your permanent molar is going to erupt? Permanent molar will erupt in class 2. But if there is a utilization of space, then they may end up in end on. Now, coming to flush terminal planes, if primary molars of primary second deciduous molars are in flush terminal plane, then permanent molars may erupt in end-on relation. But if there is utilization of spaces or continued or forward growth of the mandible, then it can lead to class 1. Now, coming to mesial stir, if primary second deciduous molar are in mesial stir, then the permanent first molar will erupt in class 1. If there is continuous utilization of space and continued growth of the mandible, this may lead to class 3. So, when permanent first molar erupt, they apply pressure on the deciduous molars, and this will lead to closure of space and also forward movement of this first permanent molar. So basically, this is called as early shift. This is called as early shift because this happens in the first transition period. That's why it's called as early shift. There is something called late shift, which I'll explain in the next slide. So early shift occurs during the early mixed dentition period. Since this occurs early in the mixed dentition, it is called as early shift. Now you have to know one more terminology, that is incisor liability. Incisor liability is the distance, is the amount of space required and the amount of space which is present in the jaw, that is called as incisor liability. Basically, the primary anteriors are smaller in size and permanent anteriors are larger in size. To accommodate this, so there is some difference called as incisor liability. So for incisor liability, the maximum for maxillary it is 7 mm and for mandibular it is 5 mm. Now, how this permanent incisors accommodate in the jaw? Usually, primary incisors, they are angulated straight with an angle of 110 degree approximately. But when it comes to permanent incisors, so it has to accommodate in the jaws by angulating themselves at around 150 to 160 degrees. This is one reason how, this is one factor how they accommodate. Various other factors also help in accommodation of permanent incisor, that is increase in the arch circumference, arch width, arch length, and also utilization of space, which is the main thing. Now coming to intertransition period, what we have learned in first transition period is there is exchange of incisors and eruption of molars. But in case of intertransition period, there's nothing going to happen in this. This occlusion is going to remain stable for 1 to 2 years. Now, if you can see this picture shows combination of primary teeth and permanent teeth. Now, you see there are permanent incisors, deciduous canine and molars, and permanent molars, first molar. Okay. Now, coming to this, the late dentition period, or you can say it as a second transition period. Second transition period. Now, if you see here, the mesodistal width of a primary canine and primary molars are much wider when compared to the permanent canine and premolars. So, when this primary teeth shed off, this permanent canine and premolar will take up this place. So, when they are taking up this place, so excess amount of space will be remaining in the jaw. So, that excess amount of uh, space which is remaining in the jaw is called as leeway space of plants. So this is what is happening in second transition period, shedding of primary molars and canine and eruption of the canines and premolar, and because of which excess space is remaining, that is called as leeway space of Nance. It was described by Nance in 1947, and in maxilla it is 1.8 mm and in mandible 3.4 mm. Now, there is something called late shift. I've already discussed about the early shift in the early transition period. Now, but late shift we are describing in the second transition period. Now, in some patients, there are no spaces. I have already told you closed dentition space and closed dentition cases. So, in those cases, what happens is when permanent first molars are erupting, they cannot push these molars as there are no spaces. So when there is a shedding of a primary canine and molars, and when there's an eruption of this permanent canine and premolars, there is an excess space remaining, that is leeway space of Nance, which I've already said. So this permanent first molars will occupy that space, and that is why it is called as late shift, which is happening in the late second transition period. There's one more significant change do happen in this second transition period is ugly duckling stage. Now you see when the permanent canines are erupting in the maxillary jaw, it apply pressure over the roots of these maxillary lateral incisors and consecutively on the roots of the maxillary central incisor. So because of which there is a distal migration of the crowns. So because of which there is a midline diastema. As the canine keeps erupting, again it applies pressure over the crown of the lateral incisor consecutively on the central incisor. So because of which the space closes. So the problem is creating on its own and it is getting corrected on its own. That's why the term self-correcting anomaly has been given to this stage. So this is also called as ugly duckling stage, which is also again called as broad bent phenomenon. So these are the three different periods you are supposed to know: the pre-dentate period, the primary dentition period, then the mixed dentition period, and this will be followed by the permanent dentition period, which you will know the characteristic features of it in Department of Prosthodontics. Thank you everyone for patient listening.